We're entering the era of a billion. That is, at any given time, a billion people will be digitally connected not to make a Facebook update, but to record a piece of data about their health. We are developing a medical device that will connect to those of the billion who suffer from COPD, asthma, stroke, Parkinson's, and various speech disorders.
In 1979, I started the pulmonary rehab program at Florida Hospital. Well, realizing there was a need for a pulmonary rehab more than just simple exercises and information, I searched for more therapies. With assistance from many of my patients, the breather was developed.
Breather Device 1 is a respiratory muscle trainer. It's still in service. There are usually at least 60 or 70,000 being used at any time.
It's used for asthma or COPD, but it also helps them clear up if they have pneumonia or tight airways. It helps get secretion moving, and it also helps them get out of the hospital faster.
I use it to ease out my asthma symptoms whenever those appear.
About a year ago, we realized that there was an opportunity for a second-generation device.
Now we're looking to catch the next generation of patients for their spoken and unspoken needs.
So for the past year, we have been interviewing therapists, doctors, and patients. A few months into that, we met Phil, which is Florida Hospital Innovation Lab. So after the last year of research, we asked what was good about Breather 1, and if you could do anything, what would make this 10 times better than it is now? There are certain problems that stand out much more than others. Patient adherence, caregiver compliance, improved collaboration between patient, caregiver, and family member, ongoing research that is actually baked into the device. All this leading to personalized treatment protocols and better outcomes for the patient. To get started, how you use this, it's very simple. First thing you do is you set up your profile based on what your condition is. You'll see all those treatment plans, and you or therapist decides which one you're going to start with. Then pick up the device, start using it, and this is where it's passively collecting all the data about your lung activity, and all that data is then feeding back into the device and stored in the cloud or stored at your hospital or your nursing homes. And if it's the therapist looking at it, they're going to see all the progress of all the patients using it. The beauty of it is the patient can be halfway around the world. So for therapists, this is great for compliance. For the patient, you've got adherence tracking all built in because they're following the plan or they're not, and it's coaching them. It's letting them know if they reach their goals. Because we're using Apple's new research kit, this data can then be shared throughout the world. It'll no longer be studies done every 3 months or every year, which are costly. These studies will be done every minute, every day, around the world. This is not just a tracking device. This is at its core what it was, and it has been for all these years, a therapeutic tool. Breather 2 is in first prototype stage. Going through all the empathy sessions, we launched right into electrical engineering, mechanical, and software. So over the course of the next 9 to 12 months, we hope to have the product ready for market. If we break this down to just one statement about what we're trying to do, is that we're going to help patients and healthcare providers move away from relationships with an episode of care to episodes of care within a relationship.